Good afternoon. My name is Marla McGuinness, and I will be your moderator for today's news conference. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Marla. Today is another difficult day for our province. Unfortunately, we are reporting 2 deaths yet again as a result of COVID complications. Both people were in their 70s and died in the hospital in the Central Zone. My condolences and sympathies go out to the families on behalf of all Nova Scotians. We are reporting 84 new cases today, the majority of them being again in the Central Zone. The number is fluctuating, but it does seem that we are still on our downward trajectory. We still have an issue in Sydney, but we added extra testing, and I want to thank those who responded to our call to get out and get tested in the area. It is our best way of tracking and containing the virus. There is good news on the vaccine front again. We've opened to 25 and up yesterday, and we've had a great response. Yesterday we've had over 20,000 needles went into arms yesterday, and we expect around the same today. We will hit 500,000 doses sometime tomorrow. Next week we'll move up to ages 20 and up, and we'll continue to go forward as 12 and up later on in the week. I encourage everyone to book an appointment when it's your turn. I know this latest shutdown has been very difficult for everyone, especially our small businesses. And I am very concerned about our small business community, our restaurants, bars, salons, all those different businesses that service Nova Scotians. I know you're going through a difficult period of time. I've actually joined in some of the consultations myself recently and learned how government can help more. So today we've announced another $17 million to go into the Small Business Impact Grant. That's going to provide more help. That's a total of $29 million we're investing during this third wave shutdown. That'll help our businesses get through this difficult period of time. And I know it's something that small businesses have asked for, looking at how we would be more flexible with this program. So every business that was eligible will get an additional $5,000 check mailed to them. So new applicants that qualify will also receive a one-time flat payment of $5,000. This latest program is in addition to the other available supports previously to small business. We value your contribution to the economy, and quite frankly, we need you. You are the backbone of our economy in Nova Scotia. I know you're anxious about looking forward to a reopening plan, and I'm looking forward to being able to do that too. Our hospitalization numbers, however, continue to be concerning for us, and we have still high case numbers. So these next 3 weeks are critical to get us to where we need to be. If our numbers continue to go down and our vaccination coverage continues to go up, we'll be in a very good place to talk about reopening our economy. It's something Dr. Strang and I have been talking about, and we're hoping to have more information for you potentially next week if we continue to stay on this path. Thank you for your hard work and patience. I look forward to your input on how we best recover from this third wave. I'll turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And along with the Premier, my thoughts and prayers also go to the 2 families today who are grieving the loss of loved ones. They are the 7th and 8th deaths we have had so far this month. The passing of these 8 Nova Scotians within 11 days is a stark reminder that we are continue to face a very serious situation. It may seem that the restrictions convey that, but we are still seeing people who are obviously not from the same household gathering and people shopping for non-essential items. Just 2 examples of how some groups are not following the public health requirements. While our case numbers are slowly trending downward, we are not able to relax our guard yet. There is an increase today, and while I am concerned, we need to keep a close eye on the trends to see that if this is a one-time blip. But all the other indicators we have show that we are on this downward trend, but it's still areas of concern. In Sydney, we continue to see some community spread, and it was really good to see a large number of people getting tested in that area yesterday. Thanks through everyone who did that, and it's an important reminder across the province. We still need people to get tested. If you have symptoms, or if you're identified by public health, or you've been in one of the exposure notification sites, please make arrangements immediately to go to one of the PACs and get tested. If you're asymptomatic, and if you have any movement and exposures out in your community, if you're still working amongst other people or the public, it's really important that you get tested at either a PAC or a pop-up on a regular, probably a weekly basis. And we need that to happen across the province to make sure that we're looking carefully for the virus. This has been a very successful week in the vaccination program. We are seeing strong uptake among young Nova Scotians after we opened to 25 to 29-year-olds on Wednesday. And the age range from 25 to 34 has had so far very good uptake, and that's a positive sign. And I want to thank everybody in that age group for that. We need all age cohorts to have high uptake if we're going to get the necessary population immunity. And if you don't have an appointment yet, don't be discouraged. More appointments will continue to be added and will be opening regularly over the coming weeks. So keep checking if you don't see an appointment right now that is a location convenient for you. And for those 12 to 24, your turn is coming very soon. As the Premier said, this week we had 2 days of 20,000 plus doses in arms, and we will have done 75,000 plus by the weekend's end. So this will be a record week, and there's more to come as our supply continues to be robust. And next week, we expect to even surpass that 75,000. And tomorrow, we will pass the target of 500,000 doses in arms, which is a substantive milestone. And we are ahead of schedule on that, but that only means we're partway down the road. We still have a lot of people that need to get vaccinated, and then we will start our second dose vaccination. So I'd like to offer my thanks to all the Nova Scotians who have booked appointments, and to the immunizers and other clinic staff, as well as the planners who are behind the scenes, who are working to make all this happen, and happen very quickly. We will have more information on the vaccine program next week, and we're working to having an update as one of our briefings next week. More of a technical update with involving potentially ADM Barbrick. I want to thank the people who are looking to move here for work or for other reasons for their patience and understanding. Limiting who enters the province, including people moving here, is important to protect our citizens and our healthcare system, which is strained right now because of COVID-19. The border restrictions have been in place for a number of weeks, and we are ready to make some adjustments to them. We are tweaking the criteria for who can move here by removing some of the date requirements. So starting today, people can apply to move to Nova Scotia if they have a purchase or sale agreement showing an offer has been accepted on or before May 1st, 2021. And we are no longer limiting the closing date if you have that offer. Second, if you have a proof of ownership of a previously purchased property in Nova Scotia and either a purchase and sale agreement for a property or notice of termination of your lease arrangement in another province or territory. So you've left your housing situation in another province or territory, and you have proof of a purchased property here in Nova Scotia. You can now come. And the third criteria is if you have a minimum 1-year lease signed on or before May 1st, 2021, and we're no longer limiting that to the date when the lease starts. And the last criteria that we're clarifying is a letter of acceptance for new employment in Nova Scotia. And this is work that cannot be done virtually or the start date deferred. And that letter of employment acceptance must be dated on or before May the 7th. We do not want people who are coming to the province to be stuck homeless because of the border restrictions, and these changes will address the majority of the concerns that we have heard over the last couple of weeks. Anybody coming through must apply via the Nova Scotia Safe Check-in and wait for approval before they start traveling here. And due to the volume of applications, only people who plan to arrive before July 1st will be considered at this time. And you should expect that it will take you up to a week before you get a decision from our team reviewing all these applications. We have a protocol for travel to support people from New Brunswick, or people traveling to and from New Brunswick, recognizing the importance of how many people do the cross-border travel on a regular basis for work and education, and how many northern Nova Scotians rely on travel into New Brunswick for medical appointments. And this Nova Scotia-New Brunswick travel protocol is now being expanded to include Prince Edward Island. So people can use the same protocol from whether it's traveling in and out of New Brunswick or in and out of PEI for travel, for work, school, childcare, legal or reasons, and specific to PEI for veterinary services at the Atlantic Vet College. People who are traveling under this protocol do not have to complete the Nova Scotia Safe Check-in and do not have to self-isolate when they enter or return to Nova Scotia, but they must follow the strict conditions that are in the protocol. And that protocol is on our coronavirus website under the travel section. And while I finish up talking about travel, I do want to remind rotational workers that we have made some adjustments to the application process to address your concerns. You still apply to enter the province via the Nova Scotia Safe Check-in for each trip home and have to wait for approval before traveling. And the first time you come, since May 14th, you will need to do the full application process, including providing some documentation that shows you work on a set rotational basis, as well as the name and location of your work site. But that documentation no longer has to be a formal letter from your employer. We will be keeping your information confidentially, but in our data system, once you're approved as a rotation worker, and then for each subsequent trip, you will get a much faster approval through our process, likely one business day, because we already have that complete documentation. I know that people are disappointed by the extension of restrictions, but I firmly believe that the restrictions can be eased up starting in mid-June, but ultimately that is up to all of us. If we all continue to buckle down and do our part, it will be our reality. So what we do each day will ensure we get to that point as soon as we can. And the next few days over this long weekend will be crucial. We need to continue to focus our efforts on reducing the number of new cases. But a long weekend is a very tempting time to get together in other social activities, which all have significant risk for increasing cases. I know people would like to have a holiday away from restrictions. That time will come soon, but it is not this long weekend. So please remain vigilant over the next few days. Follow the public health measures. Stay close to home and with your household. If you are feeling ill in any way, do not go to work. And we ask, as I said earlier, make sure you're getting tested as appropriately outlined, and get vaccinated as soon as you're eligible. When we can ease restrictions, as I said, is really all collectively up to all of us. Marla.
We will now take one question and one follow-up from media in the amount of time that we have. We'll begin with Mike Gorman, CBC. Go ahead, Mike.
Thank you. Premier, you can chime in on this if you wish, but I'd like to hear from Dr. Strang in particular. Appreciating that the province can't force anyone to get a vaccine, Dr. Strang, what is your view on whether or not patients have a right to know whether or not the medical professionals they're dealing with have been vaccinated, and in turn have the ability to decline service from them if they have not been vaccinated?
So, I mean, we have to understand at the core, your vaccination status is personal health information, and there's legislation around that, protecting people's privacy around health information. People also need to understand that that vaccination is only one part of our multi-barrier approach, and any healthcare workers have to follow a whole range of other protocols, starting with daily screening about making sure they're not coming to work with symptoms, using appropriate infection control measures such as hand washing, using appropriate personal protective equipment which protects both them and the patient. So vaccination is not the only thing that is protecting both the patient but also protects the healthcare worker. And there's also that it's a two-way exchange that we need patients to be immunized as well.
Mike, do you have a follow-up question?
Yeah, thank you, Dr. Strang. You invariably at some point during each of these briefings always plead with people to get that appointment as soon as they can, to get the needle as soon as they can. Based on whatever data is available to you, what is your assessment of how good uptake has been for hospital-based healthcare workers and home care workers? And do you have any concerns that the numbers are perhaps not as high as we need them to be or you would like them to be?
Overall, the numbers I've seen, we have a very high percentage of healthcare workers immunized. However, we know from some of our experience when we've had recent cases in our long-term care facilities that we have some gaps and we need to do some work to increase vaccine uptake in some of the staff working in some long-term care facilities, and we are actively working on that to better understand at a facility level, and then how could we work with those facilities around improving those vaccine uptake.
We'll go to Natasha Pace next with CTV. Go ahead, Natasha.
Thank you. Dr. Strang, can you talk a bit about whether or not any of the people who have been hospitalized this wave if they have had their vaccine at all? That's a question a lot of people really want an answer to.
So we're working overall and to have more data on all our cases, not just hospitalized cases, and how many of them are vaccinated. And so the epidemiologists are working to get more of that information. We should be able to bring a more comprehensive picture for it in the near future. But as I said on Wednesday, we're not surprised. We actually expect. It's normal when you have a vaccine. No vaccine's 100%. And as you have a higher and higher percentage of your population vaccinated and you still have virus circulating, you are going to get a growing proportion of your cases are going to be in people who are vaccinated. That's what we expect. It doesn't mean that the vaccine is not working. It doesn't mean that the vaccine is failing. What we know that people will get a good protection, but not 100% protection from the first dose of vaccine, and will get very good protection against severe illness, but not everybody. So some people will get what we call breakthrough infection, but we also know that people who have the breakthrough infection will get, in all likelihood, much milder symptoms and are much less likely to be able to transmit the virus to others. So even if they have a breakthrough infection, doesn't mean that the vaccine isn't providing them and others around them some benefit.
Natasha, do you have a follow-up question?
I do, thank you. I'm just wondering whether or not there is an actual plan now for people who are unable to get to a vaccine site to get their shot. I know we had talked about it when the vaccine program initially started to roll out. So for folks who are homebound or have other complex medical issues, when will they get more information about how they can receive their vaccine? Yeah,
we're coming close to be able to roll out a kind of a home care program. We'll be able, as we do our technical briefing on vaccine next week, we'll be able to talk in more detail, but there's been a lot of good work between the home care and public health to be able to, we're very close to be able to roll up that program that people who cannot get to a clinic, we can bring vaccine to them.
We'll go to Alicia Drost next with Global. Go ahead, Alicia.
Thank you. I'm just wondering if either the Premier or Dr. Strang can just clarify with the change of the rules for people who are coming in because they've already purchased a house. With these new rule changes, those who fall under the date change, can you clarify if they'll still need to file for a compassionate exemption? and just what kind of actually led to this change? Was it the high number of refusals, or was it like a legal issue?
So what we were seeing was a lot of the problems we were having. The previous rule said you had to have a closing date by, I believe it was either the 20th or 21st of May, and so we were seeing a lot of people with closing dates in the coming week. Start, the week of the 24th and onward. So we've removed that. As long as you have a purchase of agreement signed before the appropriate date, then it doesn't matter when your closing date is. You can come. The other thing that we had some problems on, people were saying, well, I actually had a purchase agreement made in 2020. And so we've removed that as well. So even if you've made a deal a number of months ago in a previous year and it's signed before the date, then you can come.
Alicia, do you have a follow-up question?
Yeah, but just not to waste the follow-up, I still just want to clarify, they still have to apply for an exemption?
Everybody has to now, it's not an exemption, everybody has to apply to come into Nova Scotia. And so but we're saying that now you're going to be able to apply, and we've widened our criteria, so we aren't going to have people getting because previously we were saying, well, your closing date is outside of our range, so you're going to have to wait, and so we're making, and then we were forcing people to then apply for a compassionate exception. So by clarifying this and broadening the criteria, people still have to apply, but we've removed most of the people the need to then either be stuck on the side of the road and then try to make an exception process.
Alicia, do you have a follow-up beyond that?
Yeah, sorry. I'm just wondering, Ontario today announced that those who got their first dose of AstraZeneca could get a second dose of AstraZeneca if they choose and make that decision for themselves. I'm just wondering if there's any more clarity on what's going to happen here in Nova Scotia.
That's all part of our work. As I said, nobody in Nova Scotia is eligible yet for a second dose, even if they got AstraZeneca. So we're actively working on what our second dose strategy will look like. Part of it is we want to be informed by the evidence from the matching studies around what is the preferred vaccine, because that is important information that people have to make an informed choice, even if we give them the option to have a second dose from AstraZeneca.
Up next is Keith Doucette with the Canadian Press. Go ahead, Keith.
Hi, Dr. Strang. I guess word's coming out of the United States now that some of the manufacturers are talking about a third potential shot. What do you know about that, and what might that mean for rollout plans? Are you even now looking at what might have to happen in regards to that? I know it's kind of advancing things a little bit, but that is fairly big in the news today.
Yeah, I'm not aware of any of those direct news reports today. We've always had conversations in public health that we don't know what the long-term future of this virus may be, and there may be the need to have subsequent booster shots even after 2 doses, whether that's even necessary or whether, how frequently it might be. The other discussion is that as we get changes and new variants there, the manufacturers may have to change some of the components of the vaccine, and then people may need a booster shot because of that. So there's no certainty on any of that. There's lots of science evolving around that, but it's certainly something we're well aware of, the possibility for that. And, we're going to get through the first 2 doses for sure, and then we'll see what the longer-term future around the potential role of any vaccine for helping control the COVID virus for long-term may be.
Keith, do you have a follow-up question?
Yes, thank you. It's for the Premier. On the $17 million, what prompted you announcing that today when we just had an announcement 2 weeks ago? Might that money have been rolled out then? I'm just wondering what happened in the interim. I know that there were many smaller businesses who were saying the initial package was not enough help, but what actually prompted you to announce something today?
Well, we extended the lockdown for an additional 2 weeks. Certainly, some of the small businesses were asking for more support. So there's been some specific asks. One was around a previous program, the real property tax rebate program, which we extended out eligibility. That was a request. A second request was around looking at this small business impact grant, and looking at the option for a flat amount, which was the $5,000 amount. And we looked at the requests. As I said, there was significant consultation with different business organizations. 6 weeks is a long time for these businesses to be shut down. So I agree they need more support, and that's why we're working in earnest to get out the support within a couple of days from the extension of the shutdown.
Okay, next we'll go to John McPhee with the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, we've heard there's a 3-day in-person professional exam that's taking place at the end of the month at a hotel in Halifax. And we've heard concerns about people who are taking that exam about the possible risks associated with it. Some are being forced to drive to HRM to take it, even though that goes against public health recommendations. So we're just wondering, does the government know about these types of exams, and would you advise against them?
So I don't know the details of the exam specifically. It's not prevented under the public health order. Although we would always say if there's a way to either defer that exam or do it virtually, that would be highly preferred. But there may be a reason that exam has to happen at that point in time. At this point in time.
John, do you have a follow-up question?
I do. This is for the Premier. Do you have any plans to provide support for parents with kids at home? For example, Ontario has a child benefit to cushion COVID costs for families with school-aged kids at home. They get $200 in the fall, another $400 in the spring. I'm just wondering if Nova Scotia has any plans to introduce a similar program.
We're looking actually right now with Department of Education and Community Services to look at what support certain families would require to ensure that they are able to deliver services. Probably would be families actually hiring people to help in an outside environment. We know it's difficult. There's a disproportionate impact to some families that have their children in school. And so we're looking at ways that we can support, and we hope to have that out early next week.
Next, we'll go to Lindsay Armstrong with All Nova Scotia. Go ahead, Lindsay.
Thank you. I'd like to follow on my colleague Mike's question. For Dr. Strang, I'm wondering if you could tell us anything more about your specific plan to work with long-term care homes where there is a gap, as you said, in those who are vaccinated.
So the first step is to understand what the actual immunization rate is at a specific facility level. We have an expectation that facilities would have that information, but many of them actually don't at this point in time in terms of if they have X number of staff, what percentage of them have been immunized. We know there may be many barriers that for people not get, whether it's they need more information. We've worked with some facilities to facilitate that they could actually encouraging them to allow their staff to go to a vaccine clinic as part of their paid work time. That may be also one of the barriers. People, hard for people to get to a clinic. So the starting point would be data, and then working with each of the facilities to try to understand what would help them to improve their vaccine coverage rate, because there may be multiple reasons why that coverage isn't where it should be.
Lindsay, do you have a follow-up question?
I do. Thank you for that, Dr. Strang. Also on the topic of vaccine uptake, it's clear in booking systems that there are many more appointments available in certain communities. One that stuck out is Cape Breton compared to somewhere like the HRM, where there may be no available bookings at the moment. I'm wondering how vaccine clinics are dispersed. Is there any sort of adjustment based on this? Are we seeing that there are more clinics, meaning there are more availabilities in certain regions like Cape Breton, or are we seeing there be higher uptake of vaccine in certain regions?
Well, we look at both. Certainly the matching up of our clinic appointments with vaccine supply is actually looked at twice a day, and we'll make adjustments. Whether it may be that if we're slowing down in an age group, that is a signal that we need to then go to the next age group. We certainly are looking at the population demographics, knowing that the percentage of the population who is older is higher outside of Halifax by and large than within the Halifax area. So we're certainly as we get into younger age groups, a greater proportion of our vaccine is being delivered and the appointments scheduled in the Halifax area. But if we are looking there's a slowdown in a certain area, we may actually pull vaccine from that area and then distribute it across to other clinics. So it's very fluid, and it's looked at, as I said, is looked at twice a day, and we manage that very closely. But ultimately, when we look at it, we are delivering large numbers of vaccine on a daily basis, and our trajectory. And if you look at how much vaccine we're delivering on a weekly basis, and almost all of the appointments do get filled up in one way or another, that vaccine is used. We have very, very low wastage of vaccine, and we do not have vaccine sitting around for any length of time waiting to go into somebody's arm.
Next, we'll go to Adrian Blom with Radio Canada. Go ahead, Adrian.
Thank you. What does the government intend to do for small business owners that say that they suffer from big box stores selling non-essential items?
So we continue to look at programs, recognizing that the federal government also provides support programs for rent and wage subsidies, and I think it's really important that we listen to the concerns that are brought forward from small businesses. It wasn't easy to put in restrictions and then extend them out, but we have to do what's in all of our collective best interests right now so that we can get to a point where we can open up sooner. And we recognize some of the larger operations, a lot of them have essential services like groceries within their building, and people need to access groceries. So it's not about what the size of the business is, it's the criteria is more about what they sell. So we look forward to working with businesses on a reopening plan, cautiously opening back up, but that's all up to all of us as Nova Scotians to work really hard over the next couple of weeks so that we're in a good position to open up again, and we will continue to be there with support programs for our businesses.
Adrian, do you have a follow-up question?
I do. Not all small businesses seem to have access to the Small Business Impact Grant. For example, somebody who is self-employed or a one-person company, what does your government plan to do for them?
We continue to have those discussions with different sector organizations and chambers across the whole province, and the Small Business Impact Grant was targeted at those businesses that were ordered to close. So we recognize that the shutdown has an impact, a residual impact across many sectors, and we do our best to ensure that we provide supports. And the best thing we can do right now is to listen to these restrictions so that we can get through this sooner, and we'll continue to meet with those sectors to ensure that we are looking at addressing their gaps, again, with the federal government programs being the primary level of support.
And we'll go next to Tim Bousquet with the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, following up on the AstraZeneca question, it's our understanding that the province has in its possession 2,000 doses of AstraZeneca that are set to expire on June 1st, which is a week from Monday. I understand that you're saying you're waiting for the Nazi guidance on that, but what happens if you don't get it before June 1st?
No, it's the end of June is the expiry date for the AstraZeneca product, not the 1st of June.
Do you have a follow-up question, Tim?
Yes. I'm wondering if you can talk about the situation in Cape Breton a little bit. Hearing an awful lot of conversations, some on TV last night, others online, characterizing it as an outbreak among young people, but I don't see that in the stats, and I see it kind of across the board. Do you have an understanding for what the situation is there?
Yeah, we know that the majority of the cases are geographically in the Sydney area, and the majority of them are in the 20 to 30-year-old population. So that's where we're focusing many of our interventions. But we also know that we need to be looking beyond that group, both geographically and age-wise, and that's why we're encouraging anybody in that kind of the CBRM area to come out and get tested. Many people have done, and I thank them for that. And we have expanded testing by adding a third drop-in center at Center 200, and we are going to be doing some pop-up testing in surrounding communities communities like Glace Bay, New Waterford in the coming days.
We'll go next to Chelsea Gould with the Truro News. Go ahead, Chelsea.
Hello, this question is for Dr. Strang. A drive-through vaccine clinic is opening in Truro. It's the second in the province after Dartmouth, and I think there's another coming in Western Zone. Could you speak to what you've seen from the drive-through approach and why public health is opening more of these in the province?
Well, excuse me, and I'm actually going for a tour of the drive-through later this afternoon at Dartmouth General Hospital. The rationale behind the drive-through is really to help support people with mobility issues and people who have people who have sensory issues, developmental delays that often come with sensory issues that make it difficult for them to get into a regular clinic situation. That we know that having a drive-through clinic makes it much easier for the accessible for these different populations. But we're not confining it to only those populations, but that is the focus and the real rationale behind the drive-through is that parts of our community being able to stay in a car makes it much easier for them to actually get vaccinated.
Chelsea, do you have a follow-up question?
Yes, thank you. Dr. Strang, just to clarify on vaccinating youth, when you open to 12 and up, I believe at the moment Moderna is only approved for 18 and up by Health Canada, so would that just be the Pfizer vaccine, and will there be a process to ensure that they only book for that?
Absolutely. So you're correct. It's only Pfizer that is licensed for the 12 to actually below 18. So we'll be using Pfizer, and that is the majority of our supply is Pfizer. And certainly, as people go to book online, they won't have other options. That will be they'll book an appointment and they'll know that it's Pfizer vaccine.
We'll go next to Victoria Walton with The Coast. Go ahead, Victoria.
Hi, thank you. Dr. Strang, earlier in the week, you said that we might be considering moving second doses up for older age groups, and a lot of other provinces, as their vaccine supply has increased, they've done the same. I'm wondering if you have an estimate on approximately what the delay might be between doses, if we won't be doing the 4 months. Do you have any estimate for the different age groups of how long it'll be?
No, I didn't say they're moving up for just a specific age group. That as we do our second dose planning, all of our appointments, regardless of age, were booked out for 105 days. But we know now, as we're getting more assurances of supply into July, that we'll be able to move all our second dose planning. We're moving everything up potentially to be able to start that second dose in July. How that affects any one individual's appointment will depend on when their second dose is. The later out your second dose is, it's more likely you're going to be a greater advance in terms of your new appointment. Overall, though, what it means is that we're going to be closer in general to a 3-month interval between first and second dose rather than a 4-month interval. And I want to reassure people that interval is absolutely safe. There's actually growing evidence. Just saw another paper this morning. People congratulating Canada for making the decision to move to a 4-month interval because the science is becoming clearer and clearer and we knew this in Canada, and our vaccine experts, that's why we said we're safe with making the decision to go to 4 months, is that a longer interval in general with vaccines produces a better immune response. So it's becoming clearer and clearer that the Canadian decision to move to that 3 to 4 month gap rather than 21, 28 days for the mRNA vaccines was a very wise decision and will create overall better immunity for people getting the vaccine at that time interval.
Victoria, do you have a follow-up question?
Yeah, thank you. And Dr. Strang, I'm also wondering about contact tracing and exposure sites at this point. I know when we were really overwhelmed a few weeks ago, public health wasn't listing all of the potential exposure sites, only the really high-risk ones. I'm kind of wondering where we're at on that, if people can trust the releases that are coming out, or if really there's a lot more exposure sites than are being listed. And I'm also wondering about contact tracing on that same note. Are contact tracers still overwhelmed? Is it sometimes taking up to, 2 to 3 days to get in touch with everyone?
No, we're back. There's several things to your question. So first of all, for the last week or more, we've resolved there's no longer a backlog in public health. So we're back in the space where, as positives come into public health, the initial reach out and the beginning of the investigation is done within a 24-hour time period. We're also connecting with positives even faster through text messages and other things. The second piece is that we did have a big backlog of resolved cases that we weren't able to finalize, and people finally they're past their a space where they're considered to have active infections, and so we've done thousands of those. So our number of active cases has come down significantly. We're also now dealing with our contacts and being able to deal with the backlog of contacts as well, and reaching out to them. And we, as we announced a few days ago, we're still not, the very people who are high-risk contacts can have to be isolated for 14 days. That we're not contacting them at their 14 days. They know they've got lots of information. They know when their 14 days is up. And the other piece is around the notifications. As we've talked about here, is about a week ago that as we got things dealt with some of the pressures from the surge of cases in public health, we're now back and have been doing this for the last week or so, that any notification, even a low-risk notification, and that's is now, again, we're back making that public. And that's why people have seen for the last week an increase in notifications. But those are by and large the low-risk notifications where all we're telling people is that you may have been exposed and that we're recommending they go get a test and they don't have to isolate while they're waiting for their test result. We've always done the higher risk exposures when we're not able to reach each of the high risk contacts directly.
Our final question will go to Shayna Luck with CBC. Go ahead, Shayna.
Hello. This question is for Dr. Strang. I know it's a question about the help coming for vulnerable students for the rest of the school year. Some families and organizations like Autism Nova Scotia say that a small number of students could go back to class to access services like speech-language therapy, occupational therapy. So I'm wondering what your stance is on a small number of those children going back to school if it could be done in a COVID-safe way.
Yeah, we're working with education on that from a pure public health perspective. We felt that that could be done, but there's lots of other logistic reasons why for education that's not something they feel is feasible at this time.
Shayna, do you have a follow-up?
Yes, thank you. Question, I'm not sure whether it's for the Premier or Dr. Strang, maybe both, but two business owners that my colleague spoke to today said small businesses are so frustrated that big box stores can still sell non-essential items that some of them are considering going ahead and opening their doors. I know there's a reopening plan coming next week. How worried are you about non-compliance with that plan, and why not restrict big box stores from selling certain things, to give small businesses an incentive to kind of stay the course?
So we've actually told the big box stores to sell essential items only. It's not something that's practical to enforce, and there were complications in other provinces that looked at roping off certain aisles and trying to figure out what is essential for some families and not essential for other families. And so there are businesses that sell essential items that are allowed to open now, and if a small business has any essential items to sell, they can do so. But we need to make sure that we are looking at how we best restrict movement, and we've told people to stay home unless they're going out for essential items or going out for exercise outside, and we're sticking to that right now because we all want to open up soon. We'll do so in a gradual way. I don't think we're that far away from that, but the next couple of weeks are critical. We'll continue to look at how we can best open up safely. We've started to get input from businesses, and public health will be with us and as we look at that plan. We are looking at next week for trying to look at how that's best going to look at how we do that slowly. And we know it's hard for small businesses, and that's why, again, today we came out with more support.
And those are all of the reporters we have on the line today. Go ahead, Premier.
Thank you. Some folks may have noticed Dr. Strang and I's tie and mask today matched. We want to thank the Savoy Theatre, one of our top performance theatres in the province in Glace Bay, for sending those along. I think they look pretty good on us. The red tartan symbolizes the resilience of Cape Bretoners, and the color of the red represents the Savoy's iconic red curtain. I know this third wave has been tough on Cape Breton and for all of us across the province. The added restrictions have been especially hard. I do understand, but the shutdown is clearly working. It's working to bring down cases faster, and we continue to need to listen to these restrictions so that we can open up sooner. Our cases are coming down, our vaccine is rolling out and ramping up. I don't want you to lose hope. Dr. Strang and I want you to be able to enjoy a summer to its fullest, but we need to do that by listening to restrictions now. If we continue on this path, slow the spread, and reduce our cases, we're optimistic that we can open up again slowly but surely. And I know this will be a difficult weekend. You can't visit friends and family, you can't go camping, and you can't go far from your home. But it's worth the sacrifice, making it, if it means that we can do more in a matter of weeks, not months. And I want to thank you for your hard work and commitment to following the protocols and restrictions. I know it's not easy, but we're making real progress together. We can do this. Have a nice and safe weekend.